Hi, and welcome to this week's Population Health Weekly. My name is Whitney Witt, and I am the inaugural Dean of the College of Health. And today we're going to be talking about the documentary Supersize Me in the context of the COVID-19 pandemic. I will be co-moderating this session with my esteemed colleague, Dr. Hyunok Choi, who is an associate professor. Next slide, please. The documentary we wanted to talk about it in the context of the pandemic. The documentary, Supersize Me, really underscores the importance of the growing obesity epidemic in the United States. Nearly 40% of adults are obese in the US. And obesity also plays an important part in the COVID-19 pandemic. It is becoming increasingly clear that obesity is one of the biggest risk factors for severe COVID-19 disease. And newly published data from New York show that those under the age of 60 who are obese were twice as likely to be hospitalized and need critical care. So next slide, please. I wanted to introduce my fellow panelists. Dr. Hyunok Choi will be moderating the session. Dr. Hal Skinner, who's the Associate Dean for Research and an Associate Professor in the College of Health, will also be a panelist. Dr. Fathima Wakeel will also be joining us. She's an Associate Professor in the College of Health. And last but not least, Dr. Ed Gomez, the Associate Professor in the College of Health. So without further ado, I'd love to turn it over to Dr. Choi, who's going to get us started with this very robust and interesting discussion today. Thank you.
Thank you so much for the kind introduction, Dean Witt. I'd like to, next slide, please. I'd like to, first of all, thank all the people who made this webinar possible, including Ms. Sherry Buss, Jeannie Cassis, and Mr. Jason Spiegel. So we'll have a brief overview of the documentary, highlighting by watching 2-minute summary of the documentary itself. I hope you had a chance to watch it on your own, and move on to discussing some of the urgent topics that we chose in the following slides. So can we hit the play button?
For you? I mean, what would happen if I ate nothing but McDonald's for 30 days straight? Would I suddenly be on the fast track to becoming an obese American? Would it be unreasonably dangerous? Let's find out. I'm ready. For you? I mean, what would happen if I ate nothing but McDonald's for 30 days straight? Would I suddenly be on the fast track to becoming an obese American? Would it be unreasonably dangerous? Let's find out. I'm ready.
Yeah, could I get the double quarter pounder with cheese meal?
Large or supersize?
I think I'm gonna have to go supersize. Look at that. Look at that Coke. That barely fits in there. Oh shit. I'm gonna, look at that. Look at how big that thing is. Look how big that French fry is. That thing is like 4 feet tall. Double quarter pounder with cheese. More calories than anything. There it is. A little bit of heaven. Mmm.
In only 30 days of eating nothing but McDonald's, I gained 24.5 pounds. My liver turned to fat, and my cholesterol shot up 65 points. My body fat percentage went from 11 to 18%, still below the national average of 22% for men and 30% for women. I nearly doubled my risk of coronary heart disease, making myself twice as likely to have heart failure. I felt depressed and exhausted most of the time, my mood swung on a dime, and my sex life was non-existent. I craved this food more and more when I ate it, and got massive headaches when I didn't. In my final blood test, many of my body functions showed signs of improvement, but the doctors were less than optimistic.
Okay, well, thank you so much. Can we move on to the next slide? So we thought in this discussion session that we simulate what might happen in a classroom setting typically by highlighting some of the points that were raised by the documentary. And we identified 4 areas that we might want to engage with the prospective students, namely food desert, personal versus corporate responsibility, vulnerable segments of the population, and finally the coordinated action. And we invite all participants in this webinar to engage by through 2 methods. You could either raise your hand, and when you are called upon, unmute and introduce yourself and raise your question, or you could write your question within the Q&A feature at the bottom to the panelists, and one of us will read the question and have it and go from there. Thank you. And next slide, please. So for our first question, we wondered, within your neighborhood where you live, how easy and affordable is it to get fresh vegetables and fruits rather than fast food? What do you identify as the biggest barrier for access to fresh ingredients? And are your personal food choices influenced by the availability or lack of certain food items? With that, we'd like to open the floor for any of the participants or the panelists, for that matter. Yes, Salvatore, Mr. Salvatore Genovese raised his hand.
Hi, I'm Salvatore Genovese, and so in my neighborhood, it isn't necessarily too difficult to gain access to food that's healthy because of like the grocery stores and stuff. But I noticed was like a big thing at my school, many other schools, and it was briefly mentioned in the movie, is like the option every day is usually pizza and fries, or sometimes cake or muffins or something to that extent that doesn't offer a lot of nutritional value. It's mostly just processed refined carbohydrates, really high in calories and fat that aren't good for you. And it's your only option, which I think that's one of the biggest problems, because especially for kids who have very malleable minds, it's easy to ingrain those bad habits. Like, for example, like I try to eat pretty healthy, like because I've been into this for a while and researching about the obesity crisis. But even for me, when I try my hardest, when I'm in school, sometimes there's not always the option to eat healthy. Like the healthiest thing to get is fried chicken, which I think that's the issue, because it's not just one school, it's schools all over the country. So I feel that there should be something to address this problem.
Well, thank you so much, Salvatore, for your experience. Does anyone else want to weigh in response to Salvatore's? Catherine raised her hand. Could you unmute and introduce yourself?
Okay, yeah. My name's Catherine.
Hi, could you speak a little more loudly? Sorry.
Sorry, yes, I can. So my name is Catherine, and I would agree with Salvatore. I think that nutrition in schools is a very big problem nationwide, especially, I know in the video they highlighted how they're trying to get a larger focus on academics, which is often at the expense of gym programs and exercise time for students. So I think that this pairing between very a struggle to get nutritious food in school as well as a struggle to get exercise, it can really impact the obesity crisis in a very negative way.
Well, thank you so much, Catherine, for your response. Does anyone else want to contribute before we move on to the next question? In terms of his or her experiences with his or her family, school, community? If not, perhaps we'll move on to the next question. So as you jog your memory within the past month, since the beginning of this pandemic, has your dietary choice changed since the beginning of the COVID-19 pandemic? Do you find yourself cooking from scratch more often, or does your family cook from scratch more often? Or does your family order in more often? So we have two participants who raised their hands, and we'll go in alphabetical order. We'll go with Grace and then Salvatore. Could you unmute and introduce yourself? Hi, Grace. Maybe Grace is having an issue with microphone. Are you there? Grace, we'll come back to you. So Salvatore, do you want to weigh in?
Sure. So, I'd say in the most part, it hasn't changed too much because I keep the same habits, and I think that goes for everyone generally speaking. That if you had bad habits before, you're mostly keeping those bad habits now in some way, or if you had good habits, you're keeping those habits. But I have noticed certain issues, like for example, all the stores around me ran out of oatmeal, which I love to eat. So just today, actually, we went through the last of the oatmeal, which is a bit of annoying. I guess it's annoying in a way. So people are cut off in the sense that I'd see some dietary choices are affected because you might have to reach for just regular cereal now, like Rice Krispies, rather than a healthy bowl of oatmeal. So I guess in a way I'm affected that way, but the pandemic doesn't necessarily change the habits yourself. So like I always try to cook as much from scratch as possible and less processed stuff. So I've been keeping with that same habit. And I find that my friends who haven't or have kept with their habits. So the big issue is like before these pandemics happen, if we could address before how to figure out what to do about that.
Well, thank you so much. Grace, would you like to try again?
Sorry, I didn't mean to press the button before and was out of the room for a second, but I actually will add that I find that a lot of families have been ordering in more. Like my family has been focused on trying to eat healthier and recognizes that like you can't really exercise as frequently or in a different way. I guess you have to adjust how you have to eat and exercise. But my family's also noticed that some people are ordering in like kind of to support local businesses in a way. So you kind of have to find a balance when something like this happens. So a balance of wanting to support local businesses, because I especially live in a very small town and some of my closest friends are like business owners, like restaurant owners who are really affected by this. So like sometimes we would find the excuse of ordering in to support our friends. So you kind of have to find that healthy balance of how do you like order in and do stuff like that, but also being healthy and that type of thing. So yeah.
Thank you so much for that. To both of you for your valuable insights. Anyone else before we move on to the next question? Okay, so I was deeply provoked by this question that the documentary raises. So I'm so excited to be addressing this question. So do you agree with the industry's claim that it is ultimately a person's responsibility to make the right food choices and not the corporate's responsibility? Any takers to this question? Wow, 3 people raised their hands. So I will go in the order, alphabetical order. Sorry, in the order of, I see the hands raised. Catherine Innersterson.
Yes, so I think I was also thinking about this when watching it, and it in a way reminded me of vaping and how the industry claimed that they weren't advertising to children, and yet some of their flavors were, directly, they were thought to like be advertising to children by offering like fruity flavors or things that would taste good. And it reminded me of this because in the same way, like the McDonald's offering like the Happy Meals and the play places for the kids, it created doubt in whether or not they were really offering it or marketing towards children, which could potentially harm them, obviously, by creating like bad habits. So I thought it was interesting how we're starting to see more and more of this like personal versus corporate responsibility in a lot of different areas of our lives.
So how, I'm curious, how do you feel? I mean, whose responsibility is it ultimately?
I think obviously, a person does have the free choice of whether or not they're going to choose it, but a lot can be done on the corporate side to really hold themselves accountable and say, look, we understand what our products are capable of doing, and just stand by their choice of whether or not they think that it's right to market to children and to try to get them in a habit of buying their product.
Well, thank you so much for that thoughtful contribution. So we'll move on to Grace and then Salvatore.
I think that obviously like people do have to take advantage of exercising on their own, but as for it being a person's responsibility to make the right choices, I think it's an unfair statement because not everyone is at the same advantage as other people. Many people are disadvantaged, and this kind of ties into the question you asked earlier about where you live and your neighborhood, because like with food deserts, I know like some places only have access to like a Dollar General or like dollar stores and those kind of stores only have very unhealthy options, like chips and stuff that's very high in calories or just not very nutritious, and people will buy that food simply because that's all they can afford, that's all that's offered for them. So some people are like genuinely just disadvantaged. They don't have the ability to get better food or they can't afford it. And so there's not much done to help people who are disadvantaged. So I don't think it's completely true.
Well, thank you so much for weighing in. So Salvatore?
I think it's a yes and no answer. So, for example, I go to school in Manhattan where this was filmed, where there's the 83 McDonald's, and by now it might be more because this was filmed a while ago. There's actually one directly across the street from my school. But at the same time, I know to have that self-control, and there's plenty of other people who don't go there every day. I haven't been to a McDonald's in months, and when I do, I don't over-order. I don't do it too much. And to partially like go into that point was I saw a little bit ago another person who actually did this challenge too, who lived off only McDonald's for a month. But what he did differently was he counted the calories to make sure that he stayed at his caloric maintenance every day rather than just eating 5,000. And he actually went to be in his most leanest state of his life, which goes to say, so it obviously isn't good for your cholesterol and all of those issues. But in terms of obesity, part of it is making those choices and being conscious about it, conscious of what you're putting into your body and how much of it, because in moderation, nothing is going to by itself contribute to a disease. It's when you overdo it and it adds up over time. So that's where the personal responsibility comes in. Well, like Grace said just now with availability, that's an issue too. Like say whether you go to a school that you are forced to only eat the cafeteria options, and which isn't that much, or you can't afford to always have a healthy meal because it's just not available in your area. That's where the responsibility to provide options comes in.
Wow, thank you so much for that thought. I mean, I have many follow-up questions, but I also wanted to make sure that we get to all the questions and the perspectives from the panelists. So we will unfortunately have to move on to the next question. So the movie producers claim that the food industry groups actively lobby against and prevent the schools from cooking fresh meals, lunches from scratch. What has your experiences been? I mean, is it feasible within your high school to adopt cooking from scratch approach? So it's been a while since I've been to a high school, so I'm very, very curious as to what your experiences have been. So we have Salvatore who raised his hand. Please go.
So I want to say it's feasible because there's technically the materials there, but the issue which it goes for many high schools, especially privatized, is they have a contract with the food supplier that basically they're paying the people who are serving the food are paying your high school to use the space to serve you. And that's a way so that the high school can operate and make money and survive. So that being said, if the school were to make food from scratch, they would lose a lot of money that they might not be able to afford to take on to just make it from scratch, which is why they're paying these providers to have easy frozen meals that are just deep fried real quick. So it's an issue, but the problem of it being feasible, it might not be at the moment with most schools.
Well, thank you so much. So, do you believe that the students, the high school students, should have any say in this matter at all?
I would like them to have a say, but it goes beyond that due to a lot of times with big issues like this, it's more of like the board of trustees and stuff like that with schools, because like the food service is such a I would say like a very high up thing that like a school student council wouldn't just be able to modify, because that includes a huge transaction between the school and the service that's providing the food. So the only thing is like a student can only have so much of a voice in this matter.
Well, thank you so much for your insights. Dr. Hal Skinner raised his hand. Professor Skinner, could you weigh in?
I actually raised my hand back at the first question to say that I had never baked a loaf of bread in my life, but since working from home, found that I learned to bake bread and was baking a lot of bread, which is a significant shift in my dietary intentions. So we've had to adapt and figure that out.
Wow. Has that also been true for all of the students who are participating in the in this webinar. Catherine, you have your hand up. Could you respond?
I would definitely say that I have been baking more. I think that my dog is the only one in my family getting skinnier. And the rest of us have all just been baking and cooking together, which has definitely been a silver lining in this horrific situation. But I noticed that we have all found ourselves lingering in the kitchen and trying to make more food for each other, which has definitely been a change just due to our busy schedules. We normally don't have time to all cook together.
Mm. Well, thank you so much, Catherine, for weighing in. So let's move on to the next sets of questions. Vulnerable segment of population. So the film was made by and depicts clinical changes over a period of a month for a person from a very privileged background when he chose to drastically change his diet. How do you think the situation would play out if a person from a vulnerable segment, such as an elderly, ethnic, racial minorities, persons with disabilities, or persons from low socioeconomic status, or LGBTQ community were to experience similar situation? And would you tie that with COVID pandemic that we're going through right now in your answer? So are we all agreeing? Oh, Professor Skinner, you have your hand up.
I was going to say that tying it into the pandemic, I suspect that if someone in a less privileged position were to undertake this, they would experience a lot more blame for the condition that they were encountering, and it would shift more away from the corporate responsibility in the argument. I'm seeing this quite a bit in discussions we're having around COVID and thinking about reopening, quote unquote, reopening states. That people who have the kinds of comorbidities or risk factors for death and poor outcomes with COVID-19 are being blamed for that situation and in a sense dismissed in the discussion about moving forward with reopening businesses and public places.
Well, thank you so much for bringing up that issue. Does anyone else want to weigh in? If you all chose to come to Lehigh and took my course, we will be delving much deeper into this issue of justice, namely environmental justice issue. If not, we'll move on to the next question. So finally, the coordinated action. If you were to become, so if you could imagine yourself as a state health policy official, what action, what interventions would you propose to address this issue raised in the movie? Anyone? Catherine?
I think for me, something that I would try to focus on is broad education on this topic. I know in my school, I actually never had a unit in high school about nutrition or about physical exercise, and it was left up to the students to find that information on their own. And I think that I would try to change that because the power of information is so plentiful. And in creating that first step of educating a lot of kids on the correct choices, then it can be easier to start tackling some of those bigger issues in terms of changing the food in the cafeterias, because then we would have the support of, more students, because they would be educated on what they're eating and what is good for their body. And so if the students have power, I have faith that they would also call for that change in their own lives.
How do you think we could improve the education so that more people voice their the need and the importance? I did not mean to ignore Salvatore. You wanted to weigh in?
Yeah, sure. If Catherine was done speaking, then so I agree with the point of the school's not doing enough to educate, not just about the cafeteria, but in the classroom. Like, it's rarely addressed. Sometimes there's a health class in some schools that briefly discuss nutrition for a day, but don't really delve into it, which is why actually at my school, I founded a nutrition and fitness club, because I saw it was just like nobody had any knowledge of this. And me and my dean of students been running this together, that like teaching kids in the school what it is like to have proper nutrition and why it's important, not just if you're an athlete, like a D1 athlete for school. It's also just really important for your health, which I feel that's been making a difference. So I'd like to see if other schools can implement clubs like this or have guest speakers, which I feel is really important. And then another problem with this is maybe increase funding to schools for these healthy options, because at one of the meetings that we held before school shut down for COVID-19, one of my friends in the club was like, well, some of these foods are like pretty expensive. What if we can't afford them? And that like really raised my mind to like, some people, even though to many of us, not all healthy food seems like too much extra of a burden compared to fast food. There's some people who aren't fortunate enough to afford even basic necessities, such as having like eggs and vegetables every day. So that's a problem, that people who want to try to be healthier and take on that personal responsibility portion discussed before, they don't have the opportunity to take that personal responsibility. And it's not even their fault, because it's just the kid put in this situation. So I feel that maybe if there's some sort of way to increase funding to providing healthier food options in schools, and in both public and private schools, which that it would be hard to implement due to the fact that it would be extremely costly, as there's hundreds of thousands of schools all over the country. But if there was some sort of state-by-state way of providing a little bit of help in getting to those nutritional options, that'd be something very beneficial to lowering the obesity rate.
Thank you. So education in conjunction with systematic funding support would be your recommendation?
Yes.
Okay. Wow, that sounds beautiful. Well, we didn't want to ignore Professor Ed Gomez, who has his hand up. Professor Gomez?
Yes, thank you very much. These are excellent responses. I really learned a lot from students' perspectives. And as someone that works on policy, if I were a state health policy, I think one of the areas that, embarrassingly the U.S. does poorly on is regulating advertisements and advertisement and marketing to kids and at-risk groups. Believe it or not, there are no federal regulations on how companies can advertise to kids and at-risk groups about their food products. Brazil, India, China, India all have regulations on where companies can advertise, when, at what time, but the U.S. doesn't. And there's a long history of organized interest groups blocking legislation that limits that. So that wouldn't stop the state level from doing that. That's the federal level, but in federalism, and the states have a lot of opportunity to be innovative in introducing legislation. So I think that would be probably the priority for me as a state health official, is limiting where these companies can market their products, especially toward near schools or within urban food deserts in poor communities. So that's all I'd like to say.
Oh, well, thank you so much for the valuable experience and scholarship. Thank you. Does anyone else want to weigh in before we move on to the next? Salvatore.
What you said about the advertisement and regulation of that, that's actually really interesting, and it reminds me of how even like with protein supplements, for example, or pre-workouts, those are being heavily advertised to young children, or not, I would say early adolescent years, which is an issue in the sense that since they're technically a dietary supplement, they're not required to be FDA certified. So if you look, there's no FDA label on any of these supplements. So they can technically put anything they want. And there was actually a pre-workout supplement that was rated and found to have meth in it, which is not good to give to kids, obviously. So these supplements that are labeled as healthy and marketed to kids, especially in flavors like there's Chips Ahoy flavor protein powder and so on, that this isn't regulated. So that's also causing a lot of health issues in addition to obesity. So I agree with having to have a change in how our regulation works.
Wow, thank you so much. Catherine, you have your hand up.
I would totally love to add to what Salvatore said. I know I walked through a Smoothie King before this pandemic, and I saw some really what looked like heavy protein powder, and it was like cinnamon roll flavored. And some of the flavors, I was like, that would be absolute gold to, a middle schooler. And it definitely made me question why they're putting those flavors out there and why they're advertising in a way the taste of it and how good it is rather than what it can actually do for your body and what it's supposed to be used for. And I think going back to, like the education part of it is to teach people to question one or two steps further into what they're eating and what they're putting into their body, because it really does have a huge effect on, how we live our life.
Very, very important point. Well, thank you so much. Does anyone else want to weigh in? If not, let's move on to the next slide. And we're here from the panelists as to what concerns them the most regarding this documentary, as well as the pandemic. Starting with Professor Skinner.
Hi, thanks very much, Professor Choi. The area of this that I've been, when I first saw this documentary, I was really interested in how the presentation of information in the documentary format contrasts with what we normally do in the scientific setting. I did a lot of the work in my postdoctoral fellowship around nutrition and risk for cancer. And we spent a lot of time working with large amounts of data, trying to get very precise models and to capture some element of our uncertainty about the study results that we're presenting, and then publish it in a really dry journal that maybe nobody will ever read. And if you're really, really lucky, it'll get picked up by a news organization for some publicity, but most people never hear about the results. But I was fascinated that this documentary picked up so much speed, and it's going on 16 years old now, and still relevant in a lot of ways. And the overall message is consistent with what we do in science, but itself, it's not scientific. And I think in the College of Health, we want to recognize and incorporate these other powerful ways to communicate information about health and in particular with this case nutrition and obesity, but really more broadly combining the scientific with the humanistic or artistic forms of expression that can reach larger audiences. And I think the same thing is true when we look at the forms of information that are coming out about COVID-19. And this is almost existential struggle going on between the forces of science and truth and understanding and other forces that I'll let Professor Gomez characterize more precisely, that are trying to undermine reliable information with unreliable or deceptive information. And I think, again, rather than just training scientists to do the dry stuff and the precise stuff. I think we all want to learn together how to incorporate the big picture, the humanities, and the information presenting. And this is a great example of it.
Thank you so much. So I'll be extremely brief because I want to give enough time to other speakers. But for me, what started all of this was when I learned about the work of Professor Peter Singer at Princeton, who has been writing about the ethics of what we eat. What is it? How are the food that we consume raised? Where do they come from, and what are they doing to the environment? And I encourage you to explore some of his very provocative works. If you don't mind, I'd like to highlight just one slide very quickly and move on. Can we go back to the presentation view and move on to the next slide? So this is a very crude summary of the greenhouse gases that are produced by the food that we eat. Specifically, quarter of the greenhouse gases produced globally are produced by the production of food. And if skipping all the bars in the middle, if we focus on the very last bar, most of the food that we generate that actually produce the most amounts of greenhouse gases are produced by livestock, namely the raising cows for human consumption. So, this has tremendous implications in the environmental pollutions, loss of ecologic diversity, emergence of certain infectious diseases, and lastly, the programming of our children. When I say programming, and I mean metabolic programming very early on in life, to program them to be more susceptible to obesity. And with that, I move on to, I turn the slides over to Professor Fathima Wakeel.
Hi, thank you so much, Professor Choi. So I really, firstly, before talking about maternal and child health, which is my field, I really wanted to add on to what Dr. Skinner had said about sort of how the documentary really wasn't very scientific. So some of the things that I took from that is that they really didn't take, when they depicted a person with a really privileged background, and they really did not talk about things like, the impacts of having a family history with a chronic disease, experiences with chronic stress that many individuals from vulnerable populations face, such as racism and other types of discrimination, or jobs with very low control, and then even lack of access to a usual source of care. So they didn't talk about any of this, and I just thought about how if a person went through this sort of change in their diet, how all of it would be even more exacerbated in terms of the impact of this type of diet on their health. So now I'd like to shift to maternal and child health perspectives. I would like to address this from a maternal and pregnancy perspective, and then from a child perspective. So we know that individuals who have an unhealthy diet comprising of high fat, high sugar, and high sodium foods do not experience a caloric deficit by any means, but they really have a rather significant micronutrient deficiency. So during pregnancy, these micronutrients such as iron, calcium, zinc, vitamin D, and folic acids are more important than ever for pregnant women, and of course the health of the fetus as well. So when a fetus experiences these micronutrient deficiencies in their intrauterine environment, we know that the infant is more likely to be born with low birth weight, which has then been linked to the onset of chronic diseases such as diabetes, hypertension, and heart disease later in life. Also, women who enter pregnancy with obesity are more likely to experience pregnancy complications. such as gestational diabetes and gestational hypertension, which also actually increase their own long-term risks of getting these chronic diseases later in life, and also increases risk for infant mortality and morbidity. And then from the child's perspective, the documentary really showcased how the fast food industry advertises to young children. And in the experiment they showed in the film, they showed that children were more likely to be able to recognize the McDonald's symbol over the picture of George Washington. So when children are socialized with these dietary patterns from a young age, it's very, very difficult to change these patterns later in life, especially when these types of foods can actually be addictive, which they also showed in the film. And finally, we know that these negative metabolic changes that occur early in childhood can lead to the development of chronic diseases earlier in life and even premature death. That's really what I wanted to share from the maternal and child health perspective. Thank you.
Thank you so much, Professor Wakeel. We'll now turn over to Professor Gomez.
Well, thank you very much, Professor Choi. And I really enjoyed this documentary. I mean, this is an area, obesity is an area that I've been doing research on for several years. Started with the US compared to Brazil. And in my latest book, Geopolitics and Health, I compared the BRICS countries, Brazil, Russia, India, China, on the rising obesity epidemic and government response. And this, although this document focuses on the US, there's a lot of themes that have emerged in those countries as well. With respect to politics, one interesting issue that emerged at the end of the documentary was the importance of interest groups and lobbying. The representative from the Grocery Manufacturing Association went on record as saying that the industry is not only trying to not only a problem, but also a solution to the problem. And the solution to the problem being that they're providing education and they're providing information to schools. And that's one strategy that industries have used in the US and these other emerging markets to try and legitimize themselves and discourage policymakers from implementing more effective regulations, such as a soda tax or regulations on marketing and sales. But the documentary also talks about how, politically powerful these interest groups are in the US. And so I think that was an excellent point that they raised. The second point is the issue of policy. And again, the documentary really didn't talk about this, but it's important, and I raised this earlier, is on regulations and on marketing and sales to children and the poor. In the US, as I mentioned earlier, there's still no federal regulations on this, and it's very embarrassing, again, compared to the other emerging economies, Brazil, India, and China, where such regulations exist. And that, again, reinforces the power and influence of the Grocery Manufacturing Association and other interest groups. And I think that one issue that needs to, one policy that needs to be implemented, as I mentioned earlier, is regulation, but also, picking up on Salvatore's discussion about, providing funding to schools and educating schools and helping schools to provide healthier foods, but also working with schools so that children do not have access to McDonald's or nearby junk food, grocery stores or fast food chains. In the UK, for example, one issue that's been a big problem is having popular delivery services such as Deliveroo or Uber Eats deliver McDonald's to kids in schools. The UK still hasn't figured out that that's a major issue and needs to be regulated. But again, regulation is difficult when industries are so powerful politically. So as a political scientist, I was very interested in to see this discussion, albeit limited, in this documentary. And I hope that this sparks some interest for students in addressing these issues from this particular angle. Thank you.
Thank you so much. We'd like to now open the floor for any last burning questions, comments from the audience. Or more general questions? Well, if not, I'd like to thank all the panelists and again, Mr. Jason Spiegel, Ms. Sherry Buss, and Ms. Jeannie Cassis for making this webinar possible. We thank all the prospective students and the candidates who took part in this webinar, and we'd like to thank you and wish you best of luck, and until we see you the next time, bye.